I'm welcome. I'm Sherrod Brown. Good to see all of you. Thank you for your activism. We would not have, as much as Bernie and I, and I think significantly more than 10 of our caucus would have voted for a Medicare for all, but I mean, it wasn't a majority. Was that? Yeah, Debbie would be. No, I really didn't think there were twice that many, but nonetheless, I know that all of us want more out of this health care bill. All of you want more out of the Senate and out of the House. There's no question about that. But I also know that we wouldn't be this far if it weren't for your activism and your persistence and your day after day after day, being in the vineyards, talking to your TV shows, talking to radio shows, doing the kind of reporting and digging up stuff that you do so very well. First of all, one thing I wanted to thank Bernie Sanders for what he did on the community health centers. That's not particularly well known in this bill. The expansion of the community health centers is going to bring health care, not health insurance, health care to millions of Americans who don't have health insurance and aren't really able to get very good care. And it really was Bernie that continued to talk to the caucus and to the leader and all of us about that. And I know that, as I am, and I said that on some of your shows, I know that a lot of you are discouraged about what's happened in the last year, discouraged about how the Senate has moved slowly on things, discouraged that the conservative, moderate wing of the Democratic Party too often seems to hold sway over both caucuses, discouraged at the sentiment in the public that Republicans are surging in some sense, and discouraged at this new progressive era that we all talked about a year ago, that we're not talking about it very much. And I think that's wrong. Let me tell you a real quick story about why I'm not so discouraged. I was, as a friend of mine, an older lawyer in Cleveland, is in his mid-70s, and he used to work he worked in the Senate in the 1960s for one of my predecessors, a progressive senator from Ohio named Steve Young, a two-term senator. And Young was here during, this guy, and working for Young, was here during the Medicare fight in the 1960s. And he said, I had lunch with him one day, and I said, why is this so hard? This shouldn't be that hard, passing health care. Obama campaigned on, we have progressive majorities in both houses. Why is this, the country wants it, why is it so hard? And he said, don't think for a moment that Medicare wasn't hard. Now we just think, well, it's probably easy to pass Medicare because it's such a great program, and everybody but a few hospitals and doctors and medical device manufacturers and drug companies, everybody else likes it by and large. And he said it was a lot harder. He said you had the same people making the same arguments. It was the John Birch Society then, it's the Tea Parties now. You had people saying it's a government takeover then, you have that now. You have people saying socialism, communism, you have a bureaucrat between the doctor and the patient, a government bureaucrat, all those things that we heard that were said in 1964 and 5, prior leading up to Medicare, and you're hearing it now. So these fights are always they're always gargantuan fights. I mean, when the insurance company's involved and the drug companies are involved and big money's involved and conservative corporate America's involved on the other side, then it's always going to be a battle, and that's why your involvement, your advocacy, your activism, all of that are so very, very important in this. Now, let me talk about a couple of other things why you shouldn't be discouraged. I look at, we are about to, again, a lot of us wanted Medicare for all. We clearly wanted that. I think the country would have supported, would have been a whole, the number of times Bernie and I are sitting in committee with Jeff Merkley and Sheldon Whitehouse and Bob Casey and others who are on our side on virtually all these issues, and we do all these complicated amendments in the Health Committee. Often we turn to each other and say, Medicare for all would have been so much simpler, so much easier to explain, all that. We all know that, but that's not in the cards starting with the president. If the president wasn't going to fight for it, we weren't going to be able to get it. But even with that, look what we're about to do. We're about to insure 30 million Americans who don't have insurance. We are very, very close to doing that. There are still a few Democratic holdouts. That's where you can help us. I was talking to Ed a minute ago about a congressman that lives about 12 miles from where I live in Greater Cleveland. This bill's not good enough for him, and I understand it's not good enough for me either. But he's saying he's going to vote against it. We need all of you to weigh in on pushing Democrats who are, whether they're on the left or more likely on the right, but a few on the left, We need you to push them. We need you to do whatever you can do to energize our base, the way Bernie talked about, to get those people on board. Again, we're about to insure 30 million people. We're about to say no more pre-existing condition, no more throwing somebody off their insurance when they get sick. I would go to the Senate floor almost every day for 3 months when we were in session, reading letters from Ohioans who a year earlier would have said they were happy with their insurance, and then they got sick, or then they had a child with a pre-existing condition, or then they lost their job and they no longer had insurance when they needed it, which is the whole point of insurance. So, I mean, you can see how this is going to matter in people's lives. Bring people on your shows or write about people who this will help. And we've got to put a human face on this way better than we have. A human face of somebody who lost their insurance, a human face of a 23-year-old who came home from college, can't get a job with insurance, can't be on her parents' insurance plan, and she's got serious asthma. I mean, you can tell those stories, get people on their shows that are hurt because we haven't passed this yet, and that will be helped when they do pass it. When we do pass it, make it as personal as that. Reconciliation, real quick. I want to say something about you. You know, the Republicans say over and over that we're turning 1/6 of the economy. We're going to jam a bill through on reconciliation. It's 1/6 of the economy. First of all, none of those arguments hold sway. It's not 1/6 of the economy. That's already been done in the bill that passed the House and the supermajority in the Senate. We're just with reconciliation dealing around the edges to make improvements in the bill. Number one. Number two, as Bernie said, 21 or 22 times since 1980, 16 of those times Republicans, including one very, very, very significant bill on the Bush tax cuts that turned $1 trillion budget surplus to $1 trillion budget deficit. And that's what Bush's reconciliation and tax cuts. So we've done plenty of big things with reconciliation. And one more thing, COBRA, the program that the Democrats in Congress have actually made accessible for the American people. COBRA, which was almost a sham, frankly, a bit of a sham when you lose your job, you can't afford to pay both the employer and the employee side and get COBRA. Well, now you can because what the Democrats have done to subsidize COBRA. Well, the R in COBRA stands for reconciliation. It was the comprehensive omnibus, consolidated omnibus budget reconciliation act. The R in COBRA stands for reconciliation, just to remind our Republican friends of that. You know, I'll close with this, that Ted Kennedy said that healthcare reform never ends. And you know, that's what this is all about. We're going to get a big deal bill through the Congress in the next month. And it's going to insure 30 million people. It's going to have great consumer protections for people that have insurance now. It gives good tax breaks to small businesses. So all the things that you know it does. And we're not done. We're going to keep fighting with the public option. We're going to try to get the public option in this bill. I don't know if we'll be successful. If we're not, we're going to keep trying. We're going to continue to make improvements on this. Once this is enacted into law, we're going to continue to make those improvements. And don't forget, we still have 59 Democratic senators. 57 plus Bernie plus another one whose name escapes me. And we still have a bigger majority than almost any time in our lifetimes. And to say that, you know, we had the progressive era in the Wilson years when we got the Federal Trade Commission, antitrust, and direct election of senators, and a whole bunch of stuff that came out of the FDA and safe drinking water and pure food and all that. We had the progressive era in the 1930s, from 33 to 36, where we got Social Security and minimum wage and labor law reform. We had the progressive era in 64, 5, and 6 with civil rights and voting rights and Head Start and the Wilderness Act and Medicare and Medicaid and so much more. And we're in the midst of a progressive era now. The Senate and House have already done many significant things that history will look kindly on, progressive history will look kindly on, and we're going to do a lot more. With 57, 58 Democratic votes, most of them progressives, not all of them, but it's up to you, and it's up to the grassroots that Bernie talked about to make sure that as Roosevelt said, I agree with you, make us do it. And you really got to make us do it on a lot of things that you have in the past. Thanks.